When WellPoint and Anthem announced a merger, one of the things they bragged about was that there had a 40% increase in profitability. That just coincidentally coincided with how much they raised my rates.
I think the failing in the system right now is the way the insurance companies, and especially HMOs, are able to do whatever they want to do in collecting money and not necessarily using that money to the good of the policyholders.
I don't like being ripped off. I don't think anybody likes being ripped off. But the bad part about this system is I cannot go anywhere else. My insurance company has told me on a number of occasions, go someplace else. They know that I can't go anywhere else because there's no other insurance company on this planet who's going to touch me. I have a pre-existing condition.
Tom Garvin's HMO repeatedly denied him a biopsy that his doctor requested to rule out cancer. Because of Tom's persistence, the HMO finally approved the biopsy, revealing cancer and the need for surgery. Tom's premiums cost over $8,000 a year, yet he still faces large prescription copays and denial of basic care benefits.
You'd think with the amount of money that is spent on health care in the United States that we should lead the world in health care. But the World Health Organization, which ranks countries according to their health statistics, rates the United States way down the line. It's actually 17th in 131 countries, but it leads the world in expenditure in healthcare systems.
We certainly aren't asking the medical industry not to make a profit and not to pay themselves well. But there's a difference between being paid well and gouging.
When I retired, our HMO was $200 and some dollars, $217 I think, and it has increased 400% in 3.5 years. On a fixed income, that's a huge increase. So our option was to go to a less expensive HMO with Kaiser Hospital, but the rub is all the medications have to be generic. Bill takes a very expensive medication that prevents seizures, and there's no generic for it. So if we take the less expensive HMO that costs a couple of hundred, $234 a month, I think, for both of us, his medication and my asthma inhalers that are not generic, those together would cost us over $1,600 every 3 months. This is hard to kind of expose ourselves and talk about Bill's epilepsy and to talk about our economic stress. I mean, you know, I would like to pretend everything is just hunky-dory, but it isn't, you know. It's just, I think there's just too much greed. To me, it just seems like it's capitalism gone amok, you know.
To ensure they will have enough money for the rest of their retirement, the Clarks were forced to sell their home. They will live in an in-law unit on their daughter's property.
This is an industry that only knows one thing, which is to make more money. And that's maybe fine if we're dealing in an industry of widgets, but when it's healthcare, the effect of that pure drive for profit, and I'm not just talking about a manageable margin where everyone gets the reward, their just reward, but we're talking about profits that are 4 to 5 times that of the Fortune 500 average. The fact that these companies are just driven by profit in a healthcare environment means that we're going to pay more for less healthcare, and more working Americans are going to be going without health care. So we need to make a basic decision, I think. I'd like to see a vote where everyone participated that said, well, let's make a decision as a community and a nation saying, all right, are we going to allow the healthcare system to go the way it's going, which is that it's going to be a commodity for only the wealthiest? Or is it something that we actually want to address in more of a utility model, a necessary component of life, and make it affordable for everybody?
A lot of people feel that what they're given, that's all they're going to get. That was my case for a long time. I never would raise my voice. I would always say, yes, this is good enough, and thank the Lord I have the money to pay for it. The day came when I could no longer pay for it. That's when I started taking a harder look at my situation. And when this opportunity arose, I told myself, this is good.
I thought it was really important to join a group that is trying to tell people or to make people aware that it's a big problem and that there are countries that have found a solution or a better solution that we have in the United States to try to help the consumer.
RX Express riders paid an average of 60% less in Canada than U.S. prices for the same medications. If California negotiated bulk discounts, its purchasing pool would be larger than Canada's and could negotiate even deeper discounts. The Foundation for Taxpayer and Consumer Rights, which organized the RX Express, is working for bulk discounting of prescription drugs at the city, state, and federal level.
I hope this RX Express is going to be the point of the arrow, so to speak, is that we're going to go out there and we're going to pave the way for other people to join us, and if enough people can join us, we maybe as a force united together we can do something about this profiteering.
We were just a voice in the wilderness, joining together with a group like this. We form a chorus, maybe they'll notice us, maybe they'll listen, maybe more people will raise their voices.
I don't think that there should be any political sides to the issue. It's too important. Everybody is affected.